lines in. So this is a priceless mind map, because this mind map on only one piece, it's covering one of the most challenging stations in Lab 2, and even for the exam of qualified doctors, GPs in UK, they struggle with this station. This mind map will give it to you all in one piece. How we can do it? Yeah, let me share it with you. The structure is the same as I do every time. Okay. First thing, the patient is coming with a presenting complaint. I will start with an open question to listen to the golden minute. Amy, can you please tell me more about that? She has mood swings, so she has irritability. I will not ask any question. I will give an open question to listen to the golden minute. Can you please tell me more? Then she will talk for 1 minute. Doctor, it has been going on for 5 months, 6 months. It's causing a lot of stress and anxiety, argument. I will listen carefully. I will listen carefully so I don't repeat anything again. Okay. After I listen carefully, I will make sure that I didn't forget anything important in data gathering or in presenting complaint from Udibara, for example, okay? Like duration, for example, if she didn't mention it, I will ask about it. Yeah. And then she mentioned symptoms of menopause. What will be my second question in my presenting complaint? I always say in every mind map, we follow the same structure. I always say the second step is asking about trigger. Was there anything triggering that at all? Yes, doctor, I stopped having a period 9 months ago. I'm not sure if this was a trigger or not. She's helping you. And then I finish my presenting complaint with other symptom of the same system or of the same illness. I'm thinking about menopause now, so I will ask about other symptoms of menopause. And the menopause has 4 symptoms. Okay, right after me if you have a pen. Menopause has 4 symptoms. First one is urogenital symptoms. Second one is vasomotor symptoms. Third one is period symptoms. And the last one is psychological symptoms. So she came with psychological symptoms like mood swings or irritability. So she gave you that. Second one is vasomotor symptoms like hot flashes and sweating. So ask her, do you have any hot flashes at all or any sweatings at all? The third one is urogenital symptoms like problem with passing urine or dryness in the vagina. And the last symptom of menopause, or the last category of symptom, is period changes. When was your last menstrual period? Was it regular before that or not? So by this first 1.5 minutes or 2 minutes, I have my diagnosis in hand. You are very good to go. Second step, as we always do, close the specific questions to rule out red flag and differentials. What would be my red flag here? My first red flag here, she's feeling irritable, she's feeling anxious. I will ask about self-harm. Amy, sometimes when people feel irritable or anxious or overwhelmed, they might have self-harm thoughts. Was that ever the case with you? No, doctor. Now you are a safe doctor. Go ahead. Okay. My second red flags are red flags for the possibility that I might give her HRT. What will be my red flag? Contraindication of using a treatment for this lady. What will be that? Do you have any past medical history, or do you have any medical history of breast problems or womb problems at all? Or does your family have any history of cancers of the womb or of the breast? Okay, so make sure you remember these two. And actually you can do them in the next step if you forgot it here. The third step, as we do in every single mind map, is the general well-being of the patient. How was this patient doing before this complaint? How is her general health? I call it general well-being. You like to call it maftosa, but I like to call it relevant maftosa. Okay, any past medical history of any period problem at all, or any problem with blood clotting at all, or breast problems at all. And then smear, very well done, doctor, for asking about smear. It's very important in the past medical history. And then medication, are you using any medication at all, especially contraception? Okay, this is a very relevant one. Okay, and then family history, important, of cancers of the womb or the breast. Okay, we already asked it here. If you forgot, you will remember here. And then I finish my relevant maftosa with relevant lifestyle. Smoking, alcohol, exercise are important because they are part of my management. Then I will finish my data gathering in every single case. In every single human being in the cubicle, I will ask about psychosocial and ICE. Why psychosocial? This lady, she has been suffering for 9 months or 7 months. Indeed, this has been affecting her life. That's why she came today. Why she came today? Because it's affecting her life. So I will need to ask about that, because I'm treating a patient, not a disease. So I will need to finish my data gathering with how that has been affecting you. Has that been stopping you from doing anything you used to do? Or what difficulties are you facing because of that? She might tell you, doctor, I feel low, I feel depressed, or whatever. Then you can remember self-harm if you forgot it. Yeah. So the mind map is designed to catch you when you forget something. And then ICE. I will need to ask patient ICE. If you don't ask ICE, or if you have any notes or academy telling you ignore ICE, ignore them. you see the patient for 10 minutes or 8 minutes and you have an idea about the diagnosis. This patient lived with this problem 8 months. So she has an idea about it, yeah. She has read about it, yeah. She has been worried about it, yeah. So ask her, what do you think might be causing your symptom? Idea. Concern, what is worrying you the most, Amy? Anything in particular you are worried about? Expectation, have you given any thoughts? How can I help you today? Yes, doctor, I would like to try HRT. I talked to my friend and she told me there is a hormone medication that can help me. Listen to your patient so you can guide the station in the right way. So ICE is always important. You can check my IBS session if you have any struggle with doing ICE or psychosocial. And then examination, offer relevant examination. Don't tell me I will examine from head to toe. That's very premature if you say that, okay? Head to toe is for kids, okay? If you do head to toe, this is for kids, not for doctors. You are a doctor, when you examine someone, you don't have time. You choose what is relevant in your examination. For me here, because I'm thinking about menopause, I'm thinking that I might need to give HRT, I will offer what can be contraindicating me to prescribe medication. Blood pressure, yes, because blood pressure problem will make me very cautious with prescribing hormones. Weight and height, yes, because high BMI will make me very cautious with prescribing hormone because that can increase the risk of cancer. Anyway, then I will start my management with a diagnosis. Having listened to you, Amy, I think you are going through the change. Okay, she will understand what is the change because she's from UK. Okay, or you can say perimenopause or menopause. You're going through menopause. What is that? Explain it in a simple language. It's a change in the balance of the body sex hormones, which does happen when you get older, and it does cause variety of symptoms like the one you described to me. So before I give you the management, which does include everything, I will ask you about investigation. Will you do investigation for this lady? Will you offer investigation such as FSH to check for menopause? Will you offer or not? Okay, everyone. Yeah, lots of confusing answer. I will give you the right answer, which you will only find in the guidelines. So if someone is asking for the information, just go to guidelines and see the same knowledge. Okay. So you will not do investigation here. You know what? Because she is in the expected age of menopause. What is the average age of menopause in UK? It is 51. Okay. So my colleague doctor who did the station, you mentioned wrong numbers, by the way. You mentioned 50 to 55, and actually the average age of menopause in UK is from 45 to 55, and the average number is 51. Okay. So when do we need to do a blood test? If someone coming now and from 45 to 55. So she is in the expected age of menopause and she is coming with typical symptom. So no need to test for menopause because this is expected in this age. But if someone coming, for example, from 45 to 55, the same age, but coming with atypical symptoms, like her symptoms are not fitting for menopause. I'm thinking about different differentials, but not fitting for menopause. In that case, I can do FSH because it will be justifiable. What will be the other indication of testing for FSH? If someone is coming with menopausal symptoms in early age, for example, younger than 40 or 45, because I might think about early menopause, or even I can think about premature ovarian insufficiency. So this is the guideline. You don't have to be scripted. You don't have to read notes. You just need to know the guidelines. And this Mind Map is giving you that. So if the patient, if GMC changes the station and brings a lady like 42 and she's coming with menopausal symptom, you don't have to get another notes or maybe different book to study from another academy. No, you know from this line, yes, she is entitled for a test then, because this is not the expected age of menopause. Expected age from 45 to 55. Okay, so thank you for answering anyway. The age of menopause, again, I will repeat, in UK from 45 to 55, okay? And the mean age is 51. So if someone coming from 45 to 55, this is expected age of menopause. I don't need to do testing. If someone less than 45, this is called early menopause, okay? You can offer testing here. If someone less than 40, this is premature ovarian insufficiency suspicion. You can think about it here. Okay, let's go ahead with management here. How can I manage this patient here and still fit it in 8 minutes here? You don't have to decide for the patient. The same what I did in the first case here. I don't have to decide for the patient. Life is more easy. Academies are making life difficult for you. They are giving you script to follow. Life is more easy. If I have this lady in my clinic every day, I just give her options and tell her choose, read about them and choose. So I will start we have few options we can help you with Amy. There are medication that does contain hormones that can help with your symptoms. This is one option, and there are non-hormonal options that can help as well. What do you think? Have you given any thoughts? What can be ideal for you? Doctor, I don't like to take hormones because I have heard that they can cause cancer, for example. Or maybe, doctor, my friend told me that hormonal or HRT are very effective. I will only go with what she wants, because this is a patient-centered approach. She is the most important person in the station. Okay, so let me give you the whole options, and you can use the mind map for 100% cases of menopause, because it can go anyway. So the first one, we have non-hormonal options that can help with your symptoms, Amy. For example, there are lifestyle changes you can try yourself to help with your symptoms. Maybe using a fan can help with the hot flashes and the sweating, wearing light clothes, making sure to have good ventilation at home, doing some sort of exercises that can help with your symptoms. What do you think about that? Will you be happy to try that? Yes, Dr. I can print a leaflet for you about that as well. Will that be helpful? Yes, Dr. And then few things else which can be non-hormonal useful as well. What else, doctors? We can offer you some medication which is used for mental health, but they are found to be effective with hot flashes as well. Something like antidepressant medication. What do you think? Will it be something you are interested to try? So we can use SSRIs for hot flashes in menopause. This is in the guidelines, okay? We can use counseling. Our colleague doctor, she offered the counseling, very well done. Okay, you can offer counseling indeed, yeah. So very well done. You can offer counseling, but counseling is only, if you see my management, it's only one point in a lot of options. So I don't have to only mention that. I give options and she chooses it. And she can use vaginal lubricants, okay, to try it. And as well, there are other options which contains hormones that can help with your symptoms or can help to replace the missing hormone or the dropping sex hormones. So for hormonal option, will you be interested to know about them? Yes, doctor. So we can give you the combined pill as an option to help to balance your your sex hormones, or we can give you what we call HRT. But before we give that to you, Amy, we need to share with you what will be the benefit and risk of using them. So before you do anything, like offering a BSA test, before you do anything, you don't have to decide. You are just a doctor, a professional. You give the patient the pros and the cons, the benefits and risks, and they choose. So the benefit of using HRTs, Amy, that it can help with your symptoms. It will be helping with controlling your symptoms. It can help as well to reduce your risk of having water infections, and it does help as well to increase your muscle power. And it does have a great help to prevent thinning of your bones or reducing your risk of having colon cancer as well. Is that okay for you? Yes, doctor. But having said that, Amy, this medication do come with a risk as well. It can increase your risk slightly of having a breast cancer, especially if we give you two hormones together with a combined preparation. And it can increase the risk of having a blood clot if we use the oral HRT or the tablet HRT. Okay, what do you think about them? Will you be happy to go for that, or would you like to have a time to think about it? Doctor, I would like to think first because I'm not interested in hormones. Indeed, there is no rush, Amy. Okay, I can give you a leaflet about both options. Take a read or have a read about them, and we can talk again next week to see what does suit you. You can talk to your partner as well. So have a read about it. I'll print a leaflet for you, and what do you think is suitable for you? We'll be happy to do for you. Okay, if you will prescribe HRT, okay, you will safety net her. If she does have any bleeding after 3 months, this is a red flag for cancer. You will arrange a follow-up indeed 3 monthly first. So this is how to cover all menopause or HRT case or perimenopause case or menopause case in 8 minutes here. You don't have to commit to one management. You can give options. We have hormonal option and non-hormonal option. Which one does interest you more? Or have you given any thoughts which one can be suitable for you or ideal for you? If she has a thought in her mind, like she read about HRT, I will start talking about HRT. What HRT? What does it mean? It's a replacement of the dropping hormone. It does have a benefit. It does have a risk. And then I will ask her, what do you think? Would you like to go for that? Would you like to think? Okay. So this way you get 12 out of 12. This way you follow the guidelines here. Okay. I hope it does help you. If you need a tutorial about menopause, I can make it later. It's a very important topic in real life. I hope you find the mind map useful. It's a priceless mind map. Even my colleagues who are GB doctors in UK and they are seniors, they are using it in their exams here. So I hope you found it useful. A quick announcement before I answer questions. We have a new mind map package or new edition of the mind map package. And this package is a complete package now. It does include more than 300 mind maps of all cases which came in Lab 2 this year, last year, and the year before. more than 300 mind maps, the same as the previous one, giving you everything from where? From the guidelines, from the Right UK practice, yeah. And you can check after me. Okay, they are short. Everyone is done in 5-10 minutes. It's a 5-10 minutes video, and in 5-10 minutes video, you know everything about the station, and you are good to go to practice the station as a UK doctor. So what you need to do is just watch 5 minutes and go practice what was written or what was given in the guidelines. Yeah. The package includes as well access to IBS session, interpersonal skills mechanics session, and this session does include everything you need to show the examiner to get 4 out of 4 in IBS. Okay, with lots of phrases for you to use to show active listening, to show sympathy, to show sharing with the patient, to ask about psychosocial and ICE, so it's still included. And there is a management mechanics session which is newly added to the package, and this one will tell you why people fail, why good people fail in BLAB 2 because of management domain. If you talk to your friends who did fail BLAB 2 before, you will find that they failed because of clinical management. Yeah. So this mechanics of clinical management will tell you how to avoid that and give you mind maps examples for that. As well, the package includes all structures you need, mind maps for all structures, for talking to an angry patient, to medical errors, counseling stations, talking with colleague, dealing with unreasonable requests, like a mother asking to know the information about her daughter, or someone asking you to hide the diagnosis for the patient, the prescriptions indeed. If you think it can be useful to make you unscripted, to make you following the guidelines, indeed you are very happy. I'm very happy to have you in. Just join my groups. I have shared them in the WhatsApp in the